In the name of Allah, who is the most merciful and the beneficent. Bismillah Rahmanir Rahim. I am Hamza Mumtaz from Department of Biotechnology, Batch 14. Today, I am going to explain two topics, HBOT and HFOT. The HBOT stands for hyperbaric oxygen therapy, and the HFOT stands for high flow oxygen therapy. Here are the subtopics of my topic, which I am going to explain today. First of all, let's discuss the HBOT. HBOT is hyperbaric oxygen therapy. Hyperbaric refers to a state of increased pressure, typically greater than atmospheric pressure at sea level. The term hyperbaric is often used in the context of hyperbaric medicine, which involves the use of high pressure environment to treat a variety of medical conditions. Hyperbaric oxygen therapy is a type of hyperbaric medicine that involves breathing pure oxygen in a pressurized chamber. The increased pressure allows the lung to take in more oxygen, which can be delivered to the body tissue and organs. HBOT is often used to treat conditions such as decompression sickness, carbon monoxide poisoning, and non-healing wounds. Importance of oxygen in human health. Oxygen is essential for human health and survival, as it is necessary for cellular respiration, brain function, and the proper functioning of the immune system. Cellular respiration is the process by which cells convert glucose into energy, while brain function requires a constant supply of oxygen to function properly. Immune system functions uses oxygen to help fight off infections and diseases. Oxygen is essential for the proper functioning of the human body, and lack of oxygen can have serious health consequences. It is necessary for cellular respiration, the immune system, and wound healing and exercise performance. Oxygen is necessary for the process of wound healing. It helps to promote the growth of new blood vessels and tissues, which are important for repairing damage in tissues. During exercise, the body requires more oxygen. During exercise, the body requires more oxygen to meet the increased demand for energy. Adequate oxygen supply is necessary for efficient exercise performance. Inadequate oxygen supply to the body can lead to tissue damage, organ failure, and even death. And chronic hypoxia and can lead to long-term health problems. Oxygen is essential for human health and well-being. Principles of oxygen hyperbaric oxygen therapy. The following are the basic principles of HBOT. Boyle's law. The law states that the pressure of a gas is inversely proportional to its volume. This means that as the pressure inside the hyperbaric chamber is increased, the volume of the gas in the case oxygen decreases, allowing more oxygen to dissolve in the blood. Henry's law. This law states that the amount of gas that dissolves in liquid is directly proportional to the pressure of the gas above the liquid. In the case of HBOT, the increased pressure in the hyperbaric oxygen chamber allows more oxygen to dissolve in the blood and other body fluid. Oxygen transport. The increased pressure in the hyperbaric chamber increases the amount of oxygen that can be transported in the blood. This allows more oxygen to be delivered to the body tissue and organs, promoting healing and reducing the risk of tissue damage. Neovascularization. HBOT can stimulate the formation of new blood vessels, which can help to deliver more oxygen to damaged tissue and promote healing. Antimicrobial effect. The increased oxygen concentration in the blood can help to fight infection by promoting the activity of white blood cells and enhancing the body's immune response. Overall, the hyperbaric oxygen therapy works by increasing the availability of oxygen to the body's tissue, promoting healing and reducing the risk of tissue damage. The principles of HBOT are based on the physical laws of gases and the effect of increased atmospheric pressure on the human body. Now let's discuss the mechanism of action of HBOT. It involves several physiological processes in the body that are influenced by the increased pressure and concentration of oxygen delivered during treatment. Increased oxygen delivery. The high pressure in the hyperbaric chamber increases the amount of oxygen that can be dissolved in the blood and other body fluid. This increased oxygen delivery promotes tissue oxygenation, enhance cellular metabolism, and support tissue repair and regeneration. Neovascularization. HBOT can stimulate the formation of new blood vessels, a process known as neovascularization. This increased blood flow and oxygen delivery can help to promote healing and reduces tissue damage. Anti-inflammatory effect. HBOT has been shown to have anti-inflammatory effect, including the reduction of cytokine production and the modulation of white blood cell activity. This can help to reduce inflammation in the body and promote healing. Antibacterial and antimicrobial effect. The increased oxygen concentration in the blood can also help to fight infection by promoting the activity of white blood cell and enhancing the body's immune response. Reduction of tissue hypoxia. HBOT can reduce tissue hypoxia, a condition in which cells are deprived of oxygen. This can help to promote healing and reduce tissue damage in conditions such as non-healing wounds, radiation, tissue damage, and certain type of neurological conditions. Overall, the mechanism of action of HBOT involves increased oxygen delivery, neovascularization, anti-inflammatory effect, antimicrobial effect, and reduction of tissue hypoxia. This effect can promote healing and reduce tissue damage in a variety of medical conditions. Now we will discuss the use of HBOT for various diseases. Let's first of all discuss the DCS. The standard treatment for decompression sickness, DCS, a condition that can occur when a person ascends to to the surface of the water too quickly after scuba diving or working in a pressurized environment. The use of HBOT for DCS is based on the principle that increase the pressure and concentration of oxygen delivered to the body can help to reduce the formation and size of gas bubble that can form in the blood and tissue after rapid decompression. The bubbles can cause a variety of symptoms, including joint pain, skin rash, fatigue, and neurological symptoms such as dizziness, confusion, and loss of consciousness. During HBOT for DCS, the patient is placed in a hyperbaric chamber. The pressure is gradually increased for 2 or 3 times the normal atmospheric pressure. The patient breathes pure oxygen at the increased pressure, which helps to dissolve the nitrogen gas bubbles in the blood and tissue, promoting the elimination from the body. The duration and the number of HBOT sessions for DCS depends on the severity of the symptom and extent of the nitrogen gas bubbles in the body. Mild causes of DCS may require 1 to 2 HBOT sessions, while more severe cases may require multiple sessions over several days. Overall, HBOT is an effective treatment for DCS decompression sickness with success rate of up to 90% when start within 6 hours of symptom onset. It is important for individuals who engage to scuba diving or work in pressurized chamber to follow proper decompression procedures and seek immediate medical attention if symptoms of DCS occurs. Now I will talk about the treatment of carbon monoxide poisoning with the help of HBOT. HBOT, hyperbaric oxygen therapy, is an effective treatment for carbon monoxide poisoning, a potential life-threatening condition that can occur when carbon monoxide gas is inhaled. Carbon monoxide is a colorless and odorless gas that is produced by incomplete combustion of fossil fuels such as gasoline, propane, and natural gas. When inhaled, carbon monoxide can bind to hemoglobin in the blood, reduces the amount of oxygen that can be transported to the body's tissue. This can cause a variety of symptoms, including headache, nausea, dizziness, confusion, and loss of consciousness. Severe cases of carbon monoxide poisoning can lead to brain damage and death. HBT works by delivering high concentration oxygen to body's tissue, which helps to replace the carbon monoxide bond to hemoglobin and restore oxygen delivery to the body's tissue. The increased oxygen delivery can also lead to reduced tissue damage caused by the lack of oxygen during the CO poisoning. During HBOT for carbon monoxide poisoning, the patient is placed in a hyperbaric chamber. Is placed in a hyperbaric chamber. The pressure is gradually increased to 2 or 3 times the normal atmospheric pressure.
Because we